hand it over to Cantor Charlie.
All right. Yom Avodah Sameach. Happy Labor Day. As the rabbi alluded to before we began, just at the beginning of services tonight, for the 23rd consecutive year, Oseh Shalom is joining synagogues, churches, and mosques all over the country to celebrate the relationship between the interests of working people and our faith traditions. I'm very proud that we have been part of this effort from the very beginning. Over the years, we've used this program to support strikes, boycotts, and other unions' causes, and several local, state, and federal legislative proposals. I've also led several music programs featuring a number of my favorite labor performers. This year, we're going to hear about a major legislative effort in Maryland. The Time to Care Act will provide paid family and medical leave for workers in our state who do not already get such benefits from their employers. And we're going to hear from one of our own tonight. Heidi Rhodes has been a longtime member of Oseh Shalom, and like so many federal employees, well, first of all, Heidi spent a career working in the federal intelligence community. And like so many federal employees, she mistakenly understood her coverage under the Hatch Act as restricting her ability to communicate with legislators concerning enacting bills she wished to see passed. But once she retired, she began making up for lost time. A couple of years ago, I accompanied Heidi on her very first trip with Jews United for Justice, a lobbying trip to Annapolis. And she's been very active in JUFJ's lobbying effort ever since. She hasn't stopped. She's not stopping anytime soon. Please welcome Heidi on her debut appearance on Labor on the Bimah.
Thanks, Charlie. I'm standing up here tonight as a volunteer leader with Jews United for Justice to tell you about paid family and medical leave, what it is, why it's important that Maryland pass it, and what you can do to help. For those that aren't familiar with it, Jews United for Justice mobilizes Jews in the Jewish community to move our region closer to social, racial, and economic justice by advancing campaigns for immediate and concrete improvements in people's lives. You can find out more about Jews United for Justice at jufj.org. I'm one of the lucky ones. As Charlie told you, I worked for the federal government, and while there is no federal paid family and medical leave, there was a system where I could accrue sick leave, which I did. And when I had my daughter, I was able to wipe out the 6 years of sick leave and most of my saved annual leave too, so that I could stay home with her and still have an income. I was able to do the same thing when my mom broke her hip and shoulder and had to stay in rehab for weeks, and when she developed kidney disease. I took my own sick leave to take care of her and take her to doctor's appointments. But millions of Marylanders are not so lucky. They are in jobs that either don't earn leave or they cannot accrue it. What do they do when they have or adopt a child, their significant other or parent or grandparent gets sick? The U.S. is the only industrialized country that does not guarantee some form of paid family leave for workers, forcing many to choose between the job they need and the family that they love when critical needs arise. Paid family and medical leave allows a person to take job-protected time away from work while earning a portion of their wages in the event they need to care for a family member or to address their own health needs. In 1993, the Family and Medical Leave Act was passed in the U.S., granting up to 12 weeks of unpaid time off for certain work. However, it does not apply to those who are self-employed or small businesses with fewer than 50 employees, like Oseh Shalom. On top of that, unpaid time off ignores the economic reality that most people need to earn money to take care of themselves and their families. Lost wages can make the difference between affording essentials like rent and groceries and being unable to. Paid time off can also help with the likely increased costs of medical bills when these situations arise. As Charlie said, in Maryland, the Paid Family Medical Leave Bill is called the Time to Care Act. If passed, It would establish a family and medical leave insurance program that would make up to 12 weeks paid leave available to Maryland workers to care for the birth, adoption, or fostering of a child, to care for themselves or family members with serious health or medical conditions, or to address the needs resulting from a military member's deployment. The leave would be funded through a state-administrated insurance pool into which employees and employers make mandatory contributions of what is estimated to be 0.75% from each paycheck, half of this paid by the employer and half by the employee. During the leave, employees receive between $50 and $1,000 per week based on the employee's weekly wage and the state's average weekly wage. The wage replacement is partial. However, lower wage workers will receive a higher percentage of their income than will higher paid employees. The Department of Labor would administer the Family and Medical Leave Insurance Program. If the state incurs startup costs, the state will be reimbursed by the insurance fund. The ongoing costs of administrating the program would be borne by the fund. In 2021, a poll showed that 88% of Maryland voters support paid family and medical leave. Paid family and medical leave is also very good for business. I have a flyer that will be available outside as you leave, and Adam's putting the link in Zoom. And this handout has information from the Maryland Center for Economic Policy on its analysis of the benefits of paid family and medical leave for business. It notes a peer-reviewed 2020 study which used state-of-the-art statistical methods to measure how workers change their behavior when they have access to paid leave. The study found no evidence that higher benefit levels encourage workers to take longer leaves. The researchers did find that the more adequate benefits increased the likelihood that workers would return to the same employer after taking leave, potentially meaning lower costs for hiring and training. Retaining workers is cost-effective because of the high costs of employee turnover. In middle and low-wage jobs, turnover costs are estimated to be between 16 and 20% of an employee wages, and at high-wage jobs, turnover costs can be more than 200% of a worker's salary. According to the Harvard Business Review, a majority of the most successful companies report that exemplary benefit programs like paid family medical leave strengthen employee loyalty and morale. In business surveys from California and New Jersey, overwhelming majorities of employers have reported that providing paid family leave has either a positive effect or no discernible negative effect on profitability. For small employers who might otherwise be unable to afford a paid family and medical leave policy, this policy levels the playing field and allows them to compete with larger businesses in recruiting and retaining a stellar workforce, which is something we have seen is getting increasingly difficult to do as we come out of this pandemic. Currently, 9 states and DC have passed paid family and medical leave. The 9 states are Rhode Island, California, New Jersey, New York, Washington, Massachusetts, Connecticut, Oregon, and Colorado. In fact, DC, with the help of a strong coalition that included Jews United for Justice, just strengthened and expanded its program in the 2022 DC budget. Like many states who have enacted paid family medical leave, it found that the dire warnings from businesses before the legislation was passed were untrue and that the leave was a benefit. For example, JUFJ recently looked to move its DC office and was considering moving to Maryland. However, it decided to stay in DC because it has paid family and medical leave program and Maryland does not. Paid family medical leave is also an equity issue. The pandemic has made clear how vulnerable workers are and how necessary a program like this is. The bill will help many people statewide, and it will be particularly helpful to low-income or part-time employees who have fewer resources to cope with these challenging circumstances, and those with chronic health conditions. Workers who face barriers to taking the leave they need are disproportionately workers of color or low-wage workers. 16% of workers nationwide needed to take family or medical leave in the past 2 years, but couldn't do so. This group includes 19% of women workers, 23% of Latinx workers, 25% of Black workers, and 30% of workers earning less than $30,000 annually. In fact, Latinx workers and those earning less than $30,000 were the least likely to receive any pay during time off. The 22 DC budget changes that will benefit the 500,000 workers employed in DC will have a substantial impact on the large population of workers of color in the district. Workers of color make up more than 80% of those those who applied for leave during the first 6 months of the program's existence. And they are also the workers most disproportionately on the front lines during the pandemic, in jobs paying low wages. With these new provisions, DC's paid leave can now be more accessible to the workers who need it most. Our congregant Brad Sachs wrote in his August 23rd Elul Reflections, "We are known as the people of the book, but we are asked by our many books not so much to take a leap of sacred thought, but to take a leap of compassionate action. This is what I'm asking of you today and going forward." JUFJ is part of the Time to Care Coalition. This coalition has grown consistently over the past several years, but the main thing missing from this campaign has been a strong grassroots organizing and an outpouring of support from individuals and communities across Maryland. Thus, I'm asking for you to take compassionate action. For Oseh to take action to sign on as a small business, and I've made that proposal to the board. For anyone here who runs a business or knows someone who does, to talk to them about this or direct them to JUFJ, or for you to speak to others in support of this. The Time to Care Coalition will have materials such as flyers available very soon, and I can get these to you if you're interested. Please consider contacting your state senator or one or all of your 3 state delegates every month or every other month to say you support this act. You can also do the action that's at jufj.org, and Adam also has the link to put in the chat that will directly send information to your senators and delegates that you support this act. JUFJ would be willing to help anyone who'd like to submit written or video testimony to the Maryland General Assembly, or anyone who's interested in holding a house party for your friends or work colleagues to learn more about paid family and medical leave. Just let me know. I can put you in touch with JUFJ. You can go to jufj.org directly. There's lots going on related to the paid family and medical leave. There's a working group. There's a state kickoff on October 17th. There are lots of ways to get involved, and I urge you all to do what you can. Thank you. And do we have time for questions, if there are any?
Yeah.
I don't know if there are any.
Take a few minutes for questions. I don't know if we have the capacity to really do questions from Zoom. Or we could certainly do them in the chat. I think for the sake of things, let's do, if Zoom folks have questions, you can put them in the chat. Does anyone here have questions or comments? We have a Yasher Koch. Mr. Real, here's the microphone. Oh wait, I don't think that, sorry. Hold on, let me make sure that's. It says it's on. Well, one comment and a question. I am assuming that this what you call to you and this cause I'm assuming that the social justice committee
Irrigation, is that right?
The Social Justice Committee can put out information about paid family medical leave, but I'm up here representing JUFJ rather.
Okay. That might be something to take back to the Social Justice Committee. My question is there when does the current legislative session start? And I'm assuming this bill is up for discussion at that session, is that right?
We believe it will be. The session starts in January and runs through April. Thank you, John, for that question. We have only a 3-month session in Maryland. This bill has been discussed many number of years. It just can't seem to get passed, and this is why we're trying to get it over the hump this year. We have heard from the sponsors of the bill in previous years that they're going to sponsor it again, so we do believe very strongly that it's going to be discussed in this session. Thank you, John, for good questions. We have another question. And John was right, the Social Justice Committee is the one who put the proposal before the board asking Oseh to support this.
What's the position of the governor right now on this legislation, and have you dealt with him, and has he signed on, or is he going to?
The governor?
Yeah.
Oh, the governor would, I don't know officially, but knowing the governor's positions on other things, our current governor would not support this. If it did pass, it would likely get a veto, and the assembly would have to override it. Our governor has vetoed every social justice law that the General Assembly has passed in his term. So I would assume he would do the same. As is his right, as the governor, nonpartisan. Any questions in the Zoom?
I was curious, if nobody else has one, of just if you have a sense of what the main obstacles are, like why hasn't it been making it to the next level?
The Chamber of Congress are the most vocal people that are against the Chamber of Commerce, thank you,
Yeah.
are the most vocal against this. They don't want anything they have to pay more money into. It's just like our health insurance. It's the same type of system. However, every state, the 9 states that passed it, including DC, everyone's experience has shown that it pays for itself very quickly. They end up having more money, and they can offer more benefits. DC's system is only 2 years old, and already they're offering increased benefits. So despite what the Chamber of Commerce says, it is not bad for business. And small businesses can't afford to offer paid family and medical leave. It's another insurance program, and when you listen to small businesses, they want this. It's the bigger businesses that don't want to have to create another program, for the most part.
Great.
Any other questions? Thank you all very much.
Thank you. Great. Yeah, Yashikar Heidi. I really had echoing in my mind as you were speaking just so many of the verses of Torah that talk about different levels of support of workers, and obviously the circumstances are changed, but this is a clear opportunity to realize that Torah's vision of justice, basic levels of justice and compassion for workers. So that was really wonderful. We will. You have sorry.
I got a little bit more. Come on, Rabbi.
Oh, okay.
This might be my last time up here. Come on. Social legislation in this country has grown in dribs and drabs. It takes a long, committed effort to get such legislation passed. The first workers' compensation law was passed in 1911 in Wisconsin. Wisconsin also passed the first unemployment insurance law in 1932. The Social Security Act was passed on August 14, 1935. It took 5 years for the system to build up enough money to start paying pension benefits. The very first pension check was paid on January 11th, 1940 to one Ida Mae Fuller. And to celebrate the 50th anniversary of the act, Joe Glazer, Oseh Shalom, wrote a song for Ida Mae. And if I remember right, Joe sang it right here on our Bimah. Ida Mae, she got her pension check today. She did a little jig and she yelled, whoopee, got less Social Security. The mailman put that check in her hand. She's the first one in the land. $22 every month. Ida Mae, don't spend it all at once. Ida Mae, she got her pension check today. Did a little jig and she yelled, whoopee, got less Social Security. They put her name down because she's number one. Started something still going on. Since that day in 1940, checks been rolling, lordy, lordy. In the footsteps of Ida Mae, millions get their checks today. Ida Mae, got her pension check today. Did a little jig and yelled, whoopee, God bless Social Security. Turn the page. The Time to Care Act that will provide paid family and medical leave to Maryland workers for longer-term absences is the next step of social legislation. If we all work together, we can get this passed this session. But we needn't wait 50 years till we write a song to celebrate. Let's try this one. Time to care, protect our families everywhere. If everyone can pay their share, then we'll all get time to care. If I have to go in sick, I'll spread it around lightning quick. I can't leave my sick child's age. If I don't work, I don't get paid. Don't make me choose, don't make me dare. Give us workers time to care. Call them in Annapolis, shout, hey there, about time we got time to care. Do what's right, do what's fair, this year pass it, time to care. Time to care, protect our families everywhere. If everyone can pay their share, then we'll all get time to care. Time to care, protect our families everywhere. If everyone can pay their share, then we'll all get time to care. תודה רבה.
All right. Well, I'm glad I didn't continue on and pass over that one. Thank you. Thank you, Charlie.